Hello everyone. For those of y'all who've gotten to Module 3 or 4 in some of my classes, you'll see that I've given you assignments called case conceptualizations. For those of y'all who've taken my classes already, you'll know what I'm asking for. This video I'm making is for those people who haven't had the opportunity to do a case conceptualization in my class, or also for people who want sort of like a re-verification that they're doing it doing it appropriately. So this is what it will look like. The assignment is specifically called the case conceptualization. You know which one it is because it'll have the module number here. In this addictions class, the first case conceptualization happens to be in Module 3. In another class, it may be Module 4, but I like all my other classes, I try to format these assignments exactly the same so there's no real question. So basically, here is the brief instructions of where you need to look in the syllabus. For this case, it's on page 8. In the addictions course, to talk specifically about what you really need in the assignment. In this section here where I'm talking about the video instructions, this is what I'm doing right now. So what I'm going to do is put this link and it'll go to your video instructions folder that's in the main home page of the modules at the top, and you can always go back and look at it again. So I've given you two different documents. One is the case conceptualization content, which we're going to go over in just a second. And then there's a case conceptualization that is blank that you can use to write up your actual assignment. Remember, please note that your assignment still needs to have a title page. You can have these headings that we're going to look at, but also remember to please put it double-spaced so that I can add comments to it and read it a bit easier. Right after, depending on which module you're in and what class, I'll find a case that's specifically kind of geared to that potential topic. But you'll see as you keep going through the classes, you're going to get like these added pieces where you can get a more comprehensive case conceptualization to use when you're actually seeing clients who may be coming with a variety of issues, whether it's multicultural issues, whether it's addictions issues, mental health issues, family, it's a child or adolescent in the schools or in private practice, etc. So let me show you the first document. We'll talk about this one first. So this is the actual document that I give you. This format is different from this blank one here. This is the blank one I told you about that you can come and fill out for yourself. I just happen to put it in this format. You can use this if it helps you remember. You'll see what I've done. This was just a little bit easier because the other one's longer, that I have all of these areas that you need to pay attention to. And I'll tell you which each of these mean. It's a long case conceptualization. What I'm doing, though, is asking you to think through all of the key steps that you need to pay attention to when you're trying to provide a conceptualization of the issues that a client might be bringing. So this is what all of this is. Let me take you back to the other one, and I'll give you some more details of what I'm actually expecting in each area. So identifying data is just that. What is the objective information that you have? What age is your client? Are they gender specific? Also meaning, have they come in? Is this someone who may have been born a male but is transitioning to female, etc.? So sex can cover a lot of different things. Race and ethnic background. I bring this up because some people aren't necessarily used to paying attention to those keys, which are extremely important when you're looking at your clients. It'll give you a significant amount of information, or at least the opportunity to reflect that this person may conceptualize their own problems differently if it's someone who may or may not look like you. So the partner status, if they're coming in with someone, is it family? Is it a child? Is it a same sex? Is it not? It's this sort of a thing that's sort of like, if they're coming with someone, what is it? You could even ask, this person might tell you, is this someone who is married, single? Those sorts of things. It's all relevant information. Their living situation, who do they live with or where do they live? Manner of dress. What is their physical appearance? You'll find sometimes that when there are people who come to you who are either like deep critical and clinical mental illness, depression, etc., their appearance may actually appear very disheveled, Maybe they haven't taken a bath for a while. So the appearance can be extremely important and get information that will help you work with your client. And then a general self-presentation. What are they showing you? What do you see? So here I've given you a list of the things you need to cover, but then again I have a more detailed or not detailed but comprehensive explanation that says the purpose of this section is to target demographic and descriptive information about the client. By reading through it, both supervisor and trainee, both you as a counselor or someone who may need to see your client for you, should be able to develop an impression of the client. As an example, a practicum student may describe a client as a 20-year-old college student, medium build, dressed in wrinkled and soiled clothing, who is extremely verbal and articulate in their interview. Boom, that's it. The presenting problem. This section should answer these questions here. Was there something that may have caused this situation? For example, some people may come in and have severe depression because it's a clinical issue. It may be a medical issue. Some people may come in with depression because their mother passed away. There is a precipitating event that has brought about this maybe clinical representation of depression. How long has this problem persisted? Is it something that occurs maybe during certain times of the year? I've often worked with people, especially around the holidays, when they've lost a parent, a child, a close family member, that you get to these holidays where they feel like they're supposed to be with their family. It can be quite difficult. Also, you can kind of see the time of year. Maybe this is a depression that is seasonal. As you know, in the winter months, we change our clock back, so we wake up when it's dark, we get out of work and it's dark. Because of the lack of sunlight, our serotonin levels can really drop, which can affect overall well-being. So here it says the trainee must help the client to be specific about the presenting problems. It's not uncommon for counselor trainees to have had 3 or 4 interviews with the client and still be unsure about the presenting problem. The trainee should help the client to identify the precipitating circumstances, consequences, and how long the client has been cognizant of the problem and whether or not it has occurred previously. So I think there's that really important point here yet. All of a sudden you get this new client, they need to talk to you right then and there. You can't necessarily always fill out all the forms you might need to when someone is in a severe state of clinical mental illness. They may come in crying. It's not always the best thing. You have to meet your client's needs. If they come in crying, you're going to say, let me set this paper right here. Yes, I need to get consent for treatment. But maybe all the other paperwork can wait for a second. We really can't say, here's a tissue, wipe that up, keep that in your head, let's talk about this paperwork, and then you can start crying again. It's not the way it works. And remember that it's not as if we're some sort of mind readers with these mystical powers to give some sort of identifying disorder or diagnosis within the first hour that we meet someone. It takes time. And sometimes clients will ask you, be really, really careful with what kind of diagnoses you are giving people, especially with very, very little information. What's also important here is what is the client's perception regarding the precipitating issues that cause the problem. Because sometimes that may be something to work on later, or may not actually be the accurate precipitating event that you can go back to this. The relevant history, meaning what is the history that's relevant to the client and their situation and which they've come to me. It doesn't necessarily mean that we have to know where they were born, where they work, all the boyfriends and girlfriends they may have had. That's not necessarily the issue. Here it is important that the reported history be relevant to the content and depth of the client's concern. The trainee who collects ream after ream of data on the client and becomes lost in the process is encouraged to focus only on material pertinent to the problem. The history may then focus on academic content, a sequential type of history, issues of social development, adjustment in school, and early family history. The data properly fitting into this section will be determined in part by the depth and length of treatment, by the particular focus of the problem, and by the theoretical orientation of the trainee or counselor. Because remember, depending on our bent, our particular theoretical framework, it tells us what what influences and may cause maladaptive behaviors. And then it also tells us, if we believe in that certain theory, what techniques we used. So there are times when you and your classmates, you and your colleagues may have a different type of interpretation of the event. This is why consultation is so important. Cultural considerations. For those of y'all in the multicultural class, it'll be really, really important who have taken the multicultural class already. Pull your book out. What does it say about someone who may come from this ethnic background? What are those things that you don't experience yourself because you're not within that cultural framework, that you know because of the information you've read that you have to pay attention to? So these are the particular things that you'll see, and make sure that you're answering all these questions here in the cultural considerations. The interpersonal style. Oh, this is so important because this is really why people often come to counseling in the first place. Are they unable to function with other people at work? Are they not able to communicate with their family? What is it that's happening? And then also, how are they behaving with you? Do they look at you? What does the posture look like? What is the nature of their relationships? Is this someone who says, I have no friends at all? I have no one that cares about me. I could be like in my house dead for 5 days before someone found me. When people are down, oftentimes they can think of those things, but then you write this information down simply because they're observations, remembering that these criteria that we've gone over may change over time. I've worked with young people who come in and they tell me at the beginning of the session, look, I'm having to leave early because I'm meeting my friends for dinner. And somewhere in the course of the session, they are saying how nobody cares about them and they have absolutely no friends. So it's kind of good to have this information to go back so that you can kind of point out a contradiction of, so you don't have any friends at all, but you're actually leaving early so you could go eat with your friends. And that be able to spark a deeper type of information. Again, here's a more lengthy description of what we're looking for. It's important for the trainee to learn the way in which the client relates to people outside of counseling and to be able to recognize parallels when they occur in the sessions. Therefore, the trainee, or you are, asked not only to attend to what the client is saying, but also the manner in which it is being said. The client's behavior in counseling often reflects to a degree their behavior in other social situations. What are the environmental factors? What are some of the factors in the world that may be affecting, including identifying the client's vulnerabilities and strengths, resources of support? Is this someone who's living way in New York, their family is from Texas, they have no support system available to them? You're it. And are there other vulnerabilities? For example, maybe a client starts coming to you after they've gone through puberty. We know that because of developmental changes in our body and our chemistry, that sometimes people can begin to develop illnesses, chemical imbalances, etc. when they go through these changes, for example, during adolescence, during a pregnancy, during kinds of menopause, etc. So we need to know what those vulnerabilities are. And also, is there a history of illness? Elements in the environment which function as stressors to the client, what are those things? What are those things that can trigger an issue that can cause problems for your client? And of course, elements in the environment which function as support. Who do they have? Again, here's further explanation. Now, the personality dynamics cover these three areas. They cover the cognitive factors, emotional factors, and behavioral factors. Examples of each are, in the cognitive factors, what's the intelligence of someone? Are they bright in articulating what their issue is? Is this difficult? What is the language and the ability to understand? Remember, you have to pay attention to someone's age to tell you how to not only treat, but support them. You cannot treat a 10-year-old the same way as you would a 20-year-old a 30-year-old or 40-year-old. Sometimes they simply might not have the developmental capacity to be able to articulate what it is that you need. I think that's probably what has been the hardest thing for me with children, because they don't always have a language to tell me what their issue is. So what is their mental alertness? This is where you kind of think, okay, is this person drunk? Is their brain, are they kind of, their voice slurred? They're not understanding what's happening. They might be drunk. Here again, the level of insight and the capacity for judgment. Remember, you may be working with someone who may not be able to make life determining situations for themselves, whether they be autistic, have other physical disabilities that have to be talked over with a caregiver. That's where some of this would fall in. These emotional factors, pay attention to those factors that regarding the client's mood during the interview, appropriateness of effect, range of emotions displayed, and cyclical aspects of the client's emotional life. You can pick up on cues from your clients. Are they someone who is crying but starts laughing in an effort to not stay in their pain? We'll have to address that somewhere in the mix. So typically, this area is about emotional states, mood during the interview, appropriateness of affect, and the range of the emotions that this person is able to show you. The behavioral is just that. What is going on with their body? How are they behaving? Sometimes young kids, they can't tell you that they're anxious, but they're having tremendous problems with their stomach. They're having nightmares, etc. They can't eat because their tummy hurts. These are those kinds of behaviors that can give us some information about things with someone when they're unable to explain what they are, maybe from an emotional or cognitive viewpoint. So these last two sections are extremely important here. This is where everything else, you use it all as a counselor and then begin to conceptualize and develop goals and interventions for treatment. In this particular conceptualization of the problem, we're asking you to give us a summary of the problem, including the most central and core dynamics of the client's personality, and note in particular the interrelationships between the major dynamics that are listed from number 1 to 7. Look at all of it you have. You have those areas where you've been extremely objective, and now it's time for you to pull out a theory and make use of it. Pull it out and look. Remember, how does a specific theory conceptualize maladaptive behavior? This is what you're looking at here. So I'm going to ask you to look at two different theories. A is usually the one that you feel most comfortable with. So a lot of people will go to things that feel most natural, like CBT or reality therapy. Is this a family? You better start looking in your systems book for if you've been through the couples and family course. So you're going to look at all of these things and say, all right then, regarding the conceptualization, what does CBT say about this person's dynamics that I've covered in 1 through 7? After you've written that out, I'm asking you to go find a second theory. Why? You can understand your theory more by understanding the differences that exist within the other theories. Also remember, one size of theory does not fit all people. So you need to be sure that you have practiced a little bit some of the other theories that may not seem so comfortable, so that you can sort of, when your theory, your foundation, it's not working with what you're using, that you do have a toolbox of others that you could apply when or if needed. After you've explained this, the nature of the problem is this is why it's happened, then you can say, let's develop some goals and intervention. Now remember, goals for counseling should be discussed with your client. You can't decide for the client what it is that they want to cover. Remember, autonomy, that's one of our guiding principles. You give them the freedom to talk about what there is that needs to be done. Now, we can at some point say, you know, I've seen this sort of pattern. You've talked, and I know you want to talk about what's happening at work, but Just in our conversation, I'm seeing how that's influencing your wife, your life with your family, with your kids, not only at work with your extended family, maybe with the kids' softball coach, those sorts of things. But I respect that this is the big problem for you. Let's focus on that. But we can always go back to the other at some point if you like. All right? Then what is the research that you need to have done? Is this someone from a cultural background that you are not familiar with? You better go find out some information. Does the client have the language? Because sometimes people come to us when they've already been given a diagnosis in a hospital or by a physician. If we don't know much about that disorder or the particular issues that it may have, you need to go and do the research for that as well. This is also if this is what the conceptualization of my problem is, using this particular theory, then what are those things that I'm going to use to and implement to help address the issues from that theory? Now, this is consultation. This is probably one of the most helpful aspects of the case conceptualization. Go to a colleague, meaning not someone who's not in the field, a counselor. Talk to your classmates. Get used to asking people, how are they perceiving this issue? What I've loved about that is that other people, because of their own bent, their own experiences, their own life, they can sometimes pull out a perspective and look at a situation which I had not even considered before. My suggestion to you is to find someone that maybe you can find someone to consult with who sort of has the same bent to you as you do in regards to the theoretical framework. But I also encourage you to find one of your classmates or someone you work with to talk about their theoretical interpretation when they're different. So consider that as an option. This is not cheating. This is called consultation. Plan strategies and interventions, just like I said before. If you've done your research and you have your theory, go back to your theory chart. The theory tells you how does it conceptualize a problem, and then what are the goals and the types of treatments that can be used to address those problems. Develop your strategies. So let's say, for instance, you have the situation, y'all have agreed on some goals. What is your plan for the next 2 sessions? What are some of those things that you're going to talk about? And that's something that you can use in this table here of this is who I'm going to consult with. These are the techniques that I'm going to use so that you have sort of this plan, if you will, when someone comes, that you're not trying to make up homework assignments or things to think about, that you have it written down so that when you see the client in the next few days, the next week, or next month, whenever this happens, that you have this written out so that you remember where the client is, where y'all were, and what the goals were for treatment. And of course, always, it's important to not only look at the problem and develop strategies. How do you know when it's worked? How do you know when your intervention has been successful? And sometimes that may be asking the client. Think about it this way. I've had some people come in and they're like, I just want to be happy. I just want to wake up and live my life and just be happy. So for me, I know what my definition of happy is, but I don't know what their definition of happy is. So we ask, what would happy look like to you? What would your life be like on a day-to-day if you were happy? And then you can use those more specific descriptions to sort of set as goals. Of course, if they're unrealistic goals, like somebody comes in and they want to be a millionaire the next week, okay, so maybe we don't have those skills, or you and I would not be doing this work on our own. But it's that sort of idea. Think about what's realistic. Help the client see what those are, and remembering that their goals are the most important. We can get them to buy in when they know that we're giving them the support that they want. So there it is. Go through it a couple of times, and of course, consult with your classmates. Again, you can use this blank document as your own. You could leave it in color; it doesn't matter. And always, as always, send me an email if you have any questions. Thanks.